medical school, but I don't want to be a doctor anymore.
Being in situations like this is terrible, and I really feel for this student. I want her to know that she's not the only one who feels this way. There are many medical students who at varying levels of training or residency feel like, I don't know what I signed up for initially. I really don't want to do this. And there's one response to this that's common, and I think it's well-intentioned, but I don't think it's very helpful. And it's that, this is a phase, you'll get to the next phase. And I feel like medical training is like that. If I only get to next week, then I only have 153 weeks until I'm done with this, and then I only have 100 more. It's all delayed gratification, right? And if that's true for her, that she wants to finish medical school, she wants to go into residency, cool. I want her to know that there are other options out there. If you finish your MD, if you do a transitional year, if you take step 3, you can be licensed to do some things in certain states. And this is outside of cosmetics or like IV hydration clinics or things like that. I would encourage her to look into expert witness work, where you can defend physicians or other healthcare professionals in a legal setting without being a lawyer, but as an adjunct to lawyers to help those people. There's obviously opportunities in clinical trials or pharma. There are many big consulting firms, think of your Bain and your McKinseys, that hire physicians because you have a set of skills that a 22-year-old outside of undergrad with an economics degree does not have. Sometimes these other careers can replace a traditional clinical income, if you think of what a primary care, ER doc, anesthesia could make. Sometimes it doesn't, but in exchange for that lesser income, you're still making a very good income, and you don't have to go through 3 to 7 to 9 years of residency and fellowship training. So to this student, or to anyone else who is considering veering off of this traditional training path, I would encourage you to look at different podcasts. White Coat Investor, Physician on Fire. If you just look at podcasts, non-traditional clinical careers, there are many options out there that if you're in a normal academic setting, they don't talk about because they're all traditional physicians working in an academic setting. So best of luck to her. That sounds really tough.